All right, okay. So hello dears. Ayan, so hello, good day. Okay, all right. So welcome to another pre-recorded lecture in our laboratory class in immunology and serology. And for this lecture, what we're going to talk about now is I think the first test, no, that we are going to discuss on detecting the parts of our immune system in a way, or the components. And for today, what we're going to focus is the CRP, or your C-reactive protein. All right, okay. So for this lecture, no, so para maiba naman, para pod dili po ko sa magpakita ninyo, no, para pod ma-miss ko ninyo, charot. Okay, all right. So I just made a Loom lecture out of this presentation, no, because again, it's quite simple din naman, and medyo walang masyadong mga side notes. All right. But again, for this lecture, what we're going to talk about is the CRP, or your C-reactive protein. Okay, all right. So what is it about, and the test in the laboratory that is performed to determine your CRP, or C-reactive protein. Okay, all right. So we'll start first with some introduction. No, your CRP is a type of your acute phase reactant. So what are acute phase reactants? These are non-specific factors in serum that are part of your natural or innate immunity. So basically these are substances, mostly proteins, that are part of your innate immunity or natural immunity. Diba? Recall the two types of immunity. You have the natural or innate and the adaptive. So since it's part of natural immunity, you already have it when you are born, no? So it's non-specific. So it does not have memory, it does not have specificity. So it targets any antigen or pathogen that may enter your body. All right? So di siya parehas sa imong adaptive immunity, di ba, na naay memory, na naay specificity. Okay? All right. So these are substances, no, usually proteins, okay, that are non-specific and are part of your innate or natural immunity. Okay? And again, these are also known as acute phase proteins, which increase rapidly. Please take note, rapidly, at least 25% due to usually infection, injury, or trauma to tissue. So when these happen, infection, injury, or trauma to tissues, when these happen to the body, then these acute phase proteins or acute phase reactants increase in amount or increase in number. All right? Okay. And again, asa sila gina-synthesize? They are synthesized by your liver. Because again, di ba, they are proteins. And recall in your clinical chemistry, the liver is the major source, no, or the major site of protein synthesis. All right, so your acute phase proteins or reactants, therefore, can also be found, or can also be found to be synthesized in your liver. All right, the liver parenchymal cells, and they increase within 12 to 24 hours in response to an increase in your cytokines or cytokines. Okay, all right. So as you can see, medyo short lang, no, 12 to 24 hours mo increase dayon sila. But again, they do not increase if walay response, or walay increase, or walay directions from your cytokines. Diba? Recall what are cytokines? Your cytokines are chemical messengers. Diba? You'll have that also in your lecture. These are, I think you already had it in your HEMA 1. Example, mga IL-1, diba? Interleukins, chemokines, no? These are again chemical messengers that direct um, and that, yeah, direct the actions, the functions of the immune system. All right, and not only the immune system, it can also direct, no, the growth of mga hematopoietic stem cells, mga ganun, diba? So again, these are chemical messengers. And again, your acute phase reactants depend on the cytokines, depend on the direction of the cytokines. So in the increase, or in the event of the increase in cytokines, this will also lead to the increase in your acute phase reactants. Okay, now what are these cytokines that influence the increase also of your acute phase reactants? You have interleukin 1 beta, all right? You have interleukin 6, and of course, your tumor necrosis factor alpha, all right? So, uh, I don't know if you can remember IL-1. Kaning IL-1, usually this is the interleukin that is associated with your fever, no, that induces fever, IL-1. All right, ayan. And some of these cytokines. Again, you'll be discussing this in your lecture with Ma'am Teddy. Okay, all right, then the some cytokines. But for our topic, these are the three major cytokines that influence the increase of your acute phase reactants. Okay. And again, these intercellular signaling polypeptides are produced by monocytes and macrophages at the sites of inflammation. So at the sites of inflammation, or yeah, infection, trauma, injury, now these monocytes, macrophages release these cytokines, and in turn, signals also the increase of uh, this acute phase reactants or APRs, 'di ba? APRs. Ayan. Now, what are some joke, sorry, again, monocytes and macrophages, they release the three cytokines, IL-1 beta, IL-6, and tumor necrosis factor alpha, which then signals your hepatocytes in the liver to release your APRs or acute phase reactants. Okay, all right. Now, what are some of the acute phase reactants that are really important, no? Here are them. Here are them. Here are they. You have the CRP or C-reactive protein. You have the serum amyloid A, the complement proteins, or yeah, the proteins found in your complement system. We'll have another discussion on that. You have the mannose binding protein, MBP. You have fibrinogen. You have haptoglobin. You have ceruloplasmin. You have alpha-1 antitrypsin, and lastly, alpha-1 acid glycoprotein. So I'm sure these some of these are familiar to you because again, these names are also found or can also be found in your discussion in clinical chemistry, no? When you discuss proteins, their different functions, then no? Fibrinogen is usually for clotting. Haptoglobin is uh, the for hemoglobin, 'di ba? Haptoglobin. Cerulplasmin is for the uh, the transport of copper, 'di ba? Ceruloplasmin, 'di ba? Recall kinsa tong disease na naay decrease in ceruloplasmin. You have Wilson disease. Tama ba? Decrease in ceruloplasmin, yes. And that's why you have increase in copper. Yes, that's in chemistry, clean chem ninyo. Recall lang, so ceruloplasmin. So those proteins that you were introduced to in clinical chemistry are also your acute phase reactants. So again, these proteins, they also help in fighting off pathogens no in your innate immune system, all right, or in your innate immunity rather. Okay, and we'll now focus our attention to your CRP or C-reactive protein. Okay, all right. Now, what is a CRP or what is CRP? It's a trace constituent of your serum, all right? Normal concentration is about zero point 0.5 mg per dl. It was initially thought to be an antibody to the C polysaccharide of your pneumococci, all right, diba? S pneumoniae, all right, because again, uh, CRP was discovered by Tillet, okay, Tillet, double T, and sorry, Tillet, and Francis, okay, ayan. So that's in your ano din, uh, Immunosero book, Tillet and Francis. So these are two people. And they discovered that when serum is added to a culture of S. pneumoniae, there was a precipitate that was formed. Okay, so they thought that it was, and then they discovered that that was CRP, and that's why they they thought that it was an antibody to the C polysaccharide of your pneumococci or S pneumoniae. All right. And again, as you can see, it increases rapidly, very fast, within 4 to 6 hours lang, and at great amount, 100 to 1,000 times, reaching a peak value within how many hours lang? 48 hours. So it's really fast. It's fast acting. Fast good siya. All right. And aside from that, your value is of the highest, no? 100 to 1,000 times. Another acute phase reactant that can reach this amount, no, is your amyloid A. SAA ra kung ibutang guys ha. Serum amyloid A. Okay? So this another acute phase reactant that can reach this amount when there is an inflammation or infection is your serum amyloid A aside from your CRP. Okay? All right. Ayan. And it declines rapidly also with cessation of the stimulus. Example, natapos ng inflammation, natapos na ang infection. So about 19 hours, mo-decrease na siya. Or mawala na siya. Plasma half-life. So that's it. That's for CRP. Initial introduction. Okay. Now, in what conditions do we see elevated levels of CRP. So first is of course bacterial infections, no? Because again they trigger inflammation, they trigger infection, so your CRP increases. Another one is rheumatoid fever, yes, because that's an autoimmune disease, so there's inflammation. Viral infections, so the same. Malignant diseases, of course. Tuberculosis, which is of course another type of inflammation, and after a heart attack, which is again another inflammation, a type of inflammation. That is why usually in the laboratory or generally CRP good is one of the most common analyte, no, or the most common test to perform to monitor acute inflammation. Okay, that is why for CRP usually good, the first thing that should come to mind ninyo is it's usually used to test for inflammation. If not by inflammation na nahitabo. All right, but it's generally non-specific. Okay, but it still tells you that there could be a problem or that there's an inflammation ongoing inside the patient's body or inside the body. All right. And the median CRP value, meaning the CRP um, value of the population of a lot of people, it increases with age, which means that as we get older, we tend to experience a lot more inflammatory diseases or inflammatory conditions. That is why our median CRP value or the general CRP value, okay, that most of the population is having or is getting is increasing. All right, because again of the notion that as we get older, we get to experience much more inflammatory conditions or inflammation. Um, inflammation. Okay, ayan. All right. Okay. Now we go now to your CRP structure. Your CRP structure is about 118,000 Daltons, and it consists of five identical subunits held together by non-covalent bonds. And five man siya, no? So meaning it's a member of the pentraxins. By the name itself, pentra, so five proteins with five subunits. That's the meaning of pentraxins. All right, so here is your CRP structure. So one, two, three, one, two, three, four, five. Ayan, so five. So this is your CRP, C-reactive protein structure. Again, 118,000 Daltons, five identical subunits, member of your pentraxins family. One, two, three, four, five. Okay. And the CRP subunits, yes, kani siya. Alright, so 5 kabo. So pentraxins. Okay. Alright, now function of your CRP. So what does it function or what is its function? So it functions somewhat like an antibody. Alright, so ihang functions, it's the same with an antibody, opsonization. So opsonization is it coats, no? It coats, when you say opsonization is, it's the process of coating the antigen so that it will then be noticed by your phagocytes, which then leads to phagocytosis. And of course, precipitation agglutination, as we mentioned, diba, are different um, what do you call this are separate lectures on these two concepts. And lastly, of course, is complement activation by the classical pathway. So again, we have a different lecture on the complement system. Okay, so yes, so again, if you recall in our lecture on antigens and antibodies, these are actually the function of antibodies, and CRP also functions the same way. That is why the CRP, you can think of it as like a primitive non-specific form of an antibody molecule. So primitive, when you say primitive, parang early form or baby form or incomplete form good of an antibody molecule. All right, but CRP is generally not an antibody. Okay, all right. It functions as an antibody, but again, it's non-specific. So um, you cannot say that it's truly an antibody. All right, okay, but it functions like an antibody. Okay, because again, but it is non-specific, so it targets any pathogen. Okay, all right. Yeah, and its effect on the antigen is generalized or standardized. It's the same. Okay, all right. Ayan. So that's for CRP. Now, for binding of the CRP, it's calcium dependent and again, as mentioned, non-specific. And the main substrate is phosphocholine or phosphocholine, which is major part or a primary part in the cell membrane of your bacteria and other pathogens, phosphocholine. All right, and other substrates, you have small ribonuclear proteins, phospholipids, peptidoglycan, and other constituents of bacteria, fungi, and parasites. So it can bind to anything. So that's why it's non-specific. And it also binds to specific receptors found on monocytes, macrophages, and neutrophils, which promotes phagocytosis. So again, furthering our notion that it functions as an antibody. So that's why you can think of it as a primitive, no, parang early form of antibody. Para siyang stage 1 antibody. And then until maabot na jutong specific yung antibodies. All right, but then again, it's not an antibody. All right, it's just still a protein. Okay, and yeah, it's not the normal antibody. It's not an antibody good, the one that we discussed, good, the IgG, IgM, and ana. Its function lang is similar to an antibody. Okay, all right, ayan. So this is an example of binding. So this is your CRP. All right. And then I sorry, you have the CRP, and this is the phosphocholine receptor of the CRP, and then this is the phosphocholine, which is found on the cell membrane, which again the CRP then binds to this. All right, and it uses calcium, using its calcium receptor and calcium in the environment, okay, for binding to assist in the binding. All right, and once the CRP is binded, it then facilitates the its other function, opsonization, phagocytosis, no, opsonization for phagocytosis, precipitation, agglutination, or even complement system activation. Okay, all right, ayan. Now, for laboratory tests, so why is CRP requested for the laboratory to be performed? Because again, it is used following a disease process to monitor if there is still inflammation, if there is still infection ongoing inside the patient's body. Again, still the same, observe the response of treatment, no? Response to treatment of the inflammation and infection, because we then determine if the CRP value decreases, which means that the body is responding to treatment to inflammation because it was able to suppress inflammation, or is the CRP still increasing, which means that the treatment is not going well, all right? The body is not responding to treatment because the inflammation is still ongoing, no? Kay taas ra gyapon ang CRP, ganun, okay. And following the course of malignancy and organ transplantation, because in the event that the CRP increases again after organ transplantation, that means that padulong siya og rejection of the organ, or in the course of malignancy, if CRP increases from a moment na nimaba siya, nisaka siya balik, it means recurrence, meaning nagbalik ang malignancy. Okay, all right. Yes, as mentioned, a rise in levels may mean a return of the malignancy or beginning of transplant rejection. Okay, so that's why we use it. All right, and another one, or another very useful way of or useful function of CRP is its correlation with heart disease. So a lot recently now, in the future, it's a lot of studies have been focused on the correlation between CRP and its relationship with heart disease. Okay, because increased levels of CRP, it's a risk factor for MI, myocardial infarction, or heart attack, and ischemic stroke in men and women who have no previous history of cardiovascular disease. It has also been found out that since coronary heart disease, no, or your yeah, that can cause or atherosclerosis that can cause heart attack, it's a chronic inflammation. Okay, and when you say chronic, di ba, long term inflammation. So chronic inflammation, long-term inflammation. So therefore, na may inflammation, long-term pag yun, so unsa may result ana sa CRP levels. It's always increasing, all right? And when the CRP levels are at increased levels, no, it then causes the endothelial cells, or the cells of your blood vessels, to be much more prone to vasoconstriction, formation of thrombus or clots, no, or mga platelet aggregation. That's why it can lead to stroke or heart attack, okay, because of the formation of mga clots, no, sa imuhang blood vessels, because again, due to increased levels of CRP because of chronic inflammation. All right, that is why ang normal levels lang ninyo is 0.47 mg per L to 1.34 mg per L. And according to CDC, Centers for Disease Control and Prevention, ilan ang established ang parang criteria for the risk for cardiovascular disease based on CRP levels. So if low cardiovascular disease risk, if imuhang CRP levels is less than 1 mg per L, average kung 1 to 3 mg per L imuhang CRP levels, and of course high cardiovascular disease risk if it's greater than 3 mg per L. All right. Therefore, CRP monitoring can be used as a preventative measure because, again, uh, we can determine based on this different categories, diba? So if we test the CRP levels of our patients, no, or if you have family members, Jan, um, we can then predict in a way, or we can then have a glimpse as to how much, no, or as to the probability of them having a cardiovascular disease because of their CRP levels. All right, so it can be a preventative measure for the potential risk again of stroke or heart attack. Okay, all right, and when we do this, we need to perform automated high sensitivity tests for CRP because we want to detect the lowest concentration possible. Because again, we want to be accurate. We want to make sure that we can be sensitive. We can test up to the smallest amount of CRP there because again we're monitoring, all right? Okay, because again we want to prevent stroke or heart attack. Okay, all right. So sorry, this is wrong slide, guys. Sorry. Okay. All right. Now we go now to a the in our laboratory unta na class, no, and also I think this will be a demo in our lab procedure. This is what we will perform in the lab unta. So we will detect your CRP levels using this test, using latex agglutination test. And what is the principle? The principle is reverse passive agglutination. So again, recall sa ato ang lecture on agglutination methods. 'Di ba? What does it mean when you say reverse passive? Press the buzzer, 'di ba? When you say reverse passive, there is an artificial carrier, so in this case, latex. And instead of putting antigens on the latex, you then put antibodies. Okay, so antibodies that are not naturally found on the latex. Okay, so you put antibodies there that is specific to the antigen or to the analyte that you want to test. So you then put antibodies to the antibody specific to your CRP. All right? Ayan. So when the latex suspension is mixed, clear agglutination is seen within 2 minutes. Okay. Reagents, of course, polystyrene latex particles coated with anti-CRP. So again, that's the point. Reverse passive man siya. So when you say reverse passive, dapat ano na, immediate dayon. Ang latex particles or the carriers, artificial carriers, are coated with antibodies. Okay, so antibodies ang naa dito. So you're detecting in a way antigen. So in this case, our antigen in a way lang, quote unquote antigen, is your CRP. Okay, and of course we need a positive and negative controls. Why? Because again, that will ensure that our reagents are working well if there are positive and negative controls. Okay, if wala tay negative positive controls, in a way ato ang test kay dili ma-validate. Okay? All right, ayan. So it needs positive and negative controls. All right, okay. So for principle, here is again your CRP found in your serum, di ba? All right. And then we add our latex particles coated with your anti-CRP, anti-human CRP. Again, that is found in the reagents. So of course, if CRP is found in your serum, they then bind to each other until they form a lattice and then precipitate or agglutinate out of solution, which we now see visible agglutination, which then means you are positive for CRP or your CRP levels is high or in a way can be detected by the test. Okay, all right. But if you want to like quantitate no the concentration of your CRP, I think you cannot do this using latex agglutination. It just only shows you that positive or negative if you have CRP at that time or uh, there is in a way inflammation ba that can lead to your CRP production. Okay. But if you want to do concentration, then we need much mga automated higher sensitivity tests for that. Okay. Again, that's the limitation lang of this test. Latex agglutination, it just determines if uh, you are producing CRP ba at this time, which could indicate possibly indicate that you have an inflammation or infection, or negative, wala ba? Negative, no agglutination, wala lang. So you that could indicate na probably you also do not have infection and inflammation at the same time because CRP is not present in your serum. All right? But again, there are limitations. It could be that gamay rang concentration sa CRP na naa sa imuhang serum at the time of testing moong wala na detect sa imuhang latex agglutination test and other factors. All right? Okay, so basically yes, that's it. The end of our CRP lecture. It's very short, no? Simple ra pud kaayo ang testing It's not that complicated. And the concept itself mismo. Basta ang point lang yun is CRP is an acute phase reactant, an acute phase protein that is found or that is a member or a component of your innate or natural immunity. So pag panganak pa nimo daan, you already have that. Okay, so it's not specific. Okay, it does not have memory. All right, it functions like an antibody, but it's not a true antibody. Okay, all right, it's still a protein. Ayan, all right. And again, together with kinsa tong usa ka acute phase reactant pod na taas jud kayo ang increase during inflammation, you have serum amyloid A. So CRP o serum amyloid A mo jud ang mabutog until 1,000 times ang increase. Alright, that is why CRP again as mentioned is the most common test or the most common analyte that can be used to measure or to detect acute inflammation. Alright, although non-specific, but again, it can still denote or yeah, it can give you an idea if na by infection or inflammation nahitabo sa imong body or sa body sa patient. Alright. Okay, so mura to siya dears. I hope na gets lang. Yes. So if you have any questions, yes, feel free to chat me, PM me or G sa atong GC. Alright, don't be shy, okay? Alright, ayan. So again, I'll see you in our next pre-recorded lecture. Thank you for listening and have a great day. Keep safe, dears.